Hi, my name is Gabrielle. I'm going to be your nurse today. Can you please state your name and date of birth?
David Palacios, 01/27/1994.
Great, I can confirm that here on the chart. I'm going to perform some hand hygiene and I'm going to don my gloves. David, I am here to perform a skin assessment on you, as well as I'm going to assess your head, your ears, your eyes, and your throat as well. Does that sound okay with you?
Yes.
Awesome. I'm going to start off by just asking you a couple of questions. This is regarding our skin assessment. Do you have any concerns right off the bat about anything going on skin related?
No.
Okay.
Last question. So.
Any previous or current skin conditions that you've actually been diagnosed with? The doctor or dermatologist?
Not that I can think of.
Okay. So I'm just going to visually inspect your skin. I'm seeing skin that is appropriate, skin color that is appropriate for your ethnicity. I am noticing that it is feeling that it's cool, dry, and intact. I'm not feeling any rough areas here on his elbows, which are exposed. I'm assessing his skin trigger here at the clavicle. I don't see any tenting. I see good retraction of the skin. I also don't see any presence of lesions, wounds, or edema or swelling. Okay, I'm gonna move right into the head assessment. Again, I'm just going to visually inspect to see that I don't spot any lesions, wounds, or deformities. I'm looking at the shape of the skull. I'm looking at also his nose here, observing that it is midline to his face. And also ears are symmetrical on either side of his face. I'm not seeing any deviations. Again, no lesions, wounds, lumps, or deformities. So, like I said, I've stated the symmetry in his face. I'm also looking at his facial expression, seeing that he does show a relaxed affect. I'm not seeing any anxiety or fear present. Yep, it matches your sunny disposition. Again, with his neck, visually inspecting that his trachea is midline into his neck. I don't see any deviations. I'm not seeing any lumps or deformities. And I'll be palpating or feeling your neck in just a moment. But also your eyes. I'm going to take a look at your eyes. And at this point, I'm going to incorporate my pen light, David. Yes, if you could remove your glasses. I'm going to shine my light. No, you don't have to go cross-eyed just yet. I'm going to shine my light on each pupil. What I'm looking for is that your pupils are round. They are equal as well, reactive to light, and that they also accommodate accommodate the light that I'm shining in it.
Okay.
Look straight at me. Great. Excellent. Sorry if that was a little bright. Next thing I'm going to do, David, with your eyes is I am going to check to see your that you can follow within your cardinal fields of vision. So if you could just follow my light with your eyes only, without tilting your head, we'll just go through that now. Want to try that one more time? That's what I'm looking for. Okay, now you can go cross-eyed.
We're cross.
Sorry. Thank you for being such a good sport. Everything looks good in your eyes. You followed my pen light very well. Okay, so at this point, like I said, I am gonna turn my pen light back on. I'm gonna have you tilt your head up so that I can take a look in your nasal passage here. Okay, I do see hair. I'm looking at the color as well. I'm not seeing any deviation in his septum. Everything looks good in there. Okay, next I'm going to move on to your mouth. If you could open your mouth and stick your tongue out, please. Okay, and if you could stick your tongue out. Awesome. All right. If you can kind of move your tongue to the bottom of your mouth, if possible. Okay, great. I'm assessing his tonsils. I didn't see any swelling, redness, any polyps to indicate infection. So, do you have any trouble swallowing?
No.
Okay, great. I also looked at his oral mucosa and saw that it was pink in there. Color doesn't. I don't see any evidence of thrush. So I'm also right now. I'm going to have you move your bottom lip down so I can just kind of check your gums. Excellent. And then same thing with your top. Great. Gums look good. And then smile for me. Yay. Okay, great. I just assessed his teeth. I didn't see any fractures, cracks, or evidence of cavity. So, do you have any dental concerns at the moment?
No.
Okay,
No,
great.
no.
Okay, great. Yeah, no signs of infection, no open wounds, no lesions, no deformities, nothing like that.
No pain.
No pain. Excellent. So I'm going to assess your ears. Again, I'm going to take my pen light, but you won't see it. And I'm just going to.
I just cleaned them.
Oh, good. I'm going to just take a look, and I'm also going to palpate your ear. Any pain there?
No.
Okay, great. Look inside his ear, noticing the color. Don't see any drainage happening. Also on this ear, any pain when I palpate your ear here?
No.
Okay, great. Take a look inside his ear. Great. I don't see any drainage there either. All right. Believe last on our lips list here. Lips also important to note that on visual inspection, as well as when I took a closer look with my pen light, the color of his lips are appropriate. They indicate that his skin is hydrated, lips are pink, and don't show any signs of jaundice or hypoxia, no blue in his lips whatsoever. Like I said, I believe the last on our list here is I'm going to go ahead and palpate areas on your neck. I'm going to feel your lymph nodes, and I'm going to also look and feel your thyroid gland as well, and have you swallow just once. Okay, so please let me know if you have any pain. Okay, feeling his lymph nodes here. I'm not feeling any swelling or I don't feel any swelling, any lumps, any deformity. Okay, I'm going to have you swallow. Okay, great. That was his thyroid gland there. I didn't feel any lumps either. Okay, great. Thank you, David. I believe that ends our assessment. Again, we went through your skin, and we also inspected and took a look at your head, ears, eyes, nose, and throat. Do you have any questions for me?
No.
Okay, great. I'm going to go ahead and finish my documentation, and the doctor should be in shortly.
Okay, thank you.
Mm-hmm.